Good afternoon, members and DG and officials from the council and from the parliament. Let me take this opportunity to welcome you to this meeting. Today, we are going to receive the briefing from the council on COVID. I think they are going to tell us what they did during this COVID. And to welcome everybody in this meeting, honorable members and DG and council. I'm not going to waste any time because it's afternoon and I know some members were working very hard today and others are still going to have a meeting. Aska, can I get the agenda for today's meeting?
Thank you, Chair. The agenda today is the briefing by the Minerals Council South Africa on the response of the mining industry to COVID-19 and the detailed discussion thereafter on the infection statistics with reference to testing, infection rates, death and recoveries. And then we'll adopt the minutes that last meeting. Thank you.
Okay. And then from our side, do we have any apologies?
Yes, Chair. We've got Mr. Matibe, Mr. Nana, and Ms. Labiskachni.
Okay. Honorable members, here is the agenda for today's meeting. Any adoption of the agenda?
Chairperson, I move the adoption of the agenda. Lindwe Bibi.
Any seconder?
Honorable Pluto, second.
Thank you very much. And then three apologies from the honorable member. Do we accept those honorable members? Honorable members?
Yes, we do. Yes, we do.
For honorable members, do we accept them?
Yes, I do. I do accept the apologies, Chairperson.
Am I? You?
Yeah, breaking, Chair.
From our side, and then after you will give the council.
Chairperson, sorry, but I'm not sure. You're quite inaudible. I'm not sure whether it's with me or is it a problem at your side, but it appears that your network is low.
Yeah, is the chairperson side, I suppose.
members, may I make a suggestion? I hear that the chairperson has got a. I would like to suggest that Honourable Ngwenya acts as acting chairperson for this for the remainder until the chairperson is connected. Will that be possible?
Agreed, Klute. I agree with you.
Hello,
What are you agreeing
member,
upon?
you hear me?
Can I hear the proposal again?
What is the proposal?
Proposing. Mdisi, are you back?
I'm back, sir.
Okay, thank you. I made a proposal but whilst you were off, but the proposal was Honourable Ngwenya act as chairperson, but you're back, so I withdraw that proposal. Thank you.
Yes, I agree with that because it seems that there is a meeting. There is a bad network on my side.
Oh, okay.
Agreed.
Yes, agreed, Mama.
Mama Ngwenya?
Mama Ngwenya.
Agreed.
Where is Mama Ngwenya?
Mama Ngwenya? In the meantime, while Mama Ngwenya is still preparing to become a chair. Can you chair the meeting because it seems that there is a problem of network from my side.
No problem, Chair. I was checking that. Is it my mic open? Can you hear me?
Yes,
yeah,
ma'am.
we can hear you, Mama.
We can hear you.
Okay. Okay. Thanks, Chair. Thank you, honorable members. We do have an agenda in front of us. Everybody got an agenda?
Yes, ma'am. Yes, ma'am.
Okay.
Yes, we did, ma'am.
Okay, Chairperson, I would like you to start with the agenda in terms of the briefing by the Mineral Council South Africa on the response of mining industry to COVID-19 and the details discussion on infection statistics with reference to testing, infecting rates, death, and recoveries. After the briefing, then we're going to do the consideration of adoption of minutes. That's our agenda. Am I correct?
Yes,
Okay.
Mama Ngwenya agreed.
Okay. And I don't think that there's anything that we wanted to add on our agenda. We agreed with the agenda as it is. Okay, honorable member, I would like to call the department to do their briefing. Who's doing a briefing, Chairperson?
DG, he will hand over to the council.
Okay.
Thank you very much, Honorable Chair, the interim chair, and also the chair of the select committee. Good afternoon to you, leadership, and also good afternoon to the honorable members of the select committee, the team from the DMRE, team DMRE, the DDGs that are in attendance, and also the chief directors and support staff to the parliament and also ministry. And also greetings to the Minerals Council. I'm sure it is led by Mr. Tibello Chabana, and there is a full team from the side of the Mineral Council that is here to take honorable members through the presentation in respect of the work that the council has been doing and it continues to do. I must indicate, honorable members, that we have been working with the Mineral Council since the starting of COVID, and I must confirm here that we have been getting a good cooperation from the council. We even get an update because we work very closely through our principal inspectors and inspectors in different regions. And so we have a very good collaborative effort together with the Minerals Council that received engaged about the meeting, Mr. Roger Baxter. He has indicated that he would not be able to be part of the meeting because of other prior, arranged engagements where he confirmed. However, there is a capable team of men and women from the side of the Minerals Council that will be able to take us through the presentation. I'm now going to hand over to Mr. Chabana to deliver the presentation to the honorable members. Over to you, Mr. Chabana.
Good afternoon, DG. Thank you very much for the introduction. Good afternoon, Honourable Chair, honourable members of the Select Committee, and then also to greetings to the DG's team and my colleagues here in attendance, whom I will name just now because if that is okay with you, Chair, there will be quite a few of us making the actual presentation that we're going to be taking you through. So it really is a great opportunity for us to be engaging the Select Committee. We don't often get this privilege, so we do really thank you very much for this opportunity. Honourable Chair, I'm just going to check who's going to load the presentation, if it's going to be from your side or whether Aubrey will load it from our side as we go through it. If it's not from the Select Committee, Aubrey, could you please load the presentation, please? Or Honourable Chair, let me rather ask how, I'm not familiar with the proceeding here. Will it be loaded by the committee secretary?
I've given presentation rights to yourself and Mr. and Aubrey, so either of you can present the document.
Oh, okay. Let me just ask. Sorry about that. I should have arranged that then. I'm on an iPad device that doesn't have it at the moment. If I can just ask Aubrey, please, if you can just load the presentation onto the system for us. In the meantime, while I do just a brief introduction. Aubrey, can you hear me?
Yes, Tewelo, can hear you. I'm trying to do that as we speak.
Thank you very much. Honourable members, just to, while we get Aubrey loading up the presentation, we've got quite a team from the Minerals Council. We've got my colleagues, Nikisi Lusufi, who's responsible for health, environmental, and legacies. We've got also Dr. Balfour, who has been leading the charge for us when it comes to essentially dealing with COVID-19. We've also got some colleagues of ours. We've got Henk Langenhoven, who is our chief economist. He's going to certainly take us through the economic part of the presentation. We've got Aubrey Ramawa, as that you're familiar with, who is essentially responsible for stakeholder relations and is in our Cape Town office. And then also we've got Fundiso Ndaba, who's also in the Public Affairs and Transformation Department of, and then I think that's essentially the full team from the Minerals Council. I think I can't see any other names there. Oh, we've got Alex Kumar. Apologies, Alex Kumala will be taking us through the portion of the presentation that deals with communities. Okay. Aubrey, I'm going to carry on talking there. I haven't seen the presentation come up. If you are struggling, please do shout.
Yeah, I'm busy with it.
And okay, thank you very much. Honorable members, just to, I mean, I think you're all familiar, certainly with the Minerals Council, what used to be the Chamber of Mines in terms of what we are as an organization. You'll be familiar with the fact that we do represent some 90% of mining production in South Africa by value. And we've got quite a broad range of membership, from your large multinational companies to mid-tier miners and to small mining companies. To the extent that those small mining companies actually make up about, I think it's now a third of our membership are really what you would call small emerging mining companies. Yeah, so you know that we essentially the advocacy, one of the privacy bodies for the Minerals Council. And so it was essential for us to try to grapple and take a leadership role when it came to COVID-19. And that's what we have done. I think it really was quite a novel situation, one that we were dealing with really uncharted territory in terms of dealing with this pandemic. And so it was, I must say, quite a unique challenge for the industry. The first person that's going to be talking, Chair, will be Dr. Balfour, who's really going to be leading us on the approach that the Minerals Council took in terms of dealing with COVID. Aubrey, I can see the presentation. If you can just put it into presentation mode, that would be great. And honourable members, at the end of the presentation, pardon me for suggesting this, but members, maybe if you can't hear anything, please do interrupt us. But we are certainly open and welcome for questions after the presentation, at which stage I will certainly divert some of the questions to my colleagues, the various colleagues to answer. So if Aubrey, if you can go to the next slide, please. This is essentially the flow of the presentation. So without further ado, let's go to the next slide, Aubrey, and I will hand over to Dr. Balfour. I will just go off camera just so that we do reduce that. And I would just request Dr. Balfour, just go on camera for a second so that the honourable members can see you, and then I would suggest maybe go off camera to reserve bandwidth.
Thank you, Tibelo, and good afternoon, honorable members of parliament. This is just so you know how I look when you meet me in the street, and then I will shut the camera down. Thank you. Thanks for the introduction. As Tibelo has said, you know, the COVID epidemic has required that the country as a whole and the Minerals Council mount a huge response to counter the epidemic. And we have been balancing what is said to be lives being lost versus livelihoods that were also going to be lost. And on both counts, we're, you know, going to lose. And I think the country has done fairly well in doing that, starting with the early lockdowns, which saved the country in terms of massive numbers of people who could have caught the epidemic, the disease. As has been said, this is a novel virus and it has caused unprecedented social and economic disruption. And we always say that because it's so new, no one can also say that they are an expert on this. Which is why, anyway, the country has got a ministerial advisory committee that advises the minister and the president on our steps regarding the condition. The next slide. Here, I just show what the timeline looks like. We all know about the town of Wuhan, which is where this started in December, and how the WHO alerted countries of this new pneumonia, and it was identified early in January. It's
just to indicate the fact that the Mineral Council was fairly quick off the mark in terms of identifying that this was a very different disease and we needed to act very fast. And so from February, even before the epidemic was declared to be a pandemic by the WHO, the Mineral Council started to communicate with its members and distribute educational material so that people could start informing or educating employees regarding how to prevent and avoid contracting the virus. The next slide. We then went on to develop a number of materials. By the 17th of March, we had developed a 10-point plan, which was more of a preparedness plan. And in that, we put in simple things like order your flu vaccines, order your PPE. As we all know, there was a huge scramble in the country for PPE. We had advised our members as early as March that this is going to require PPE. Make sure you've got your stocks in place. And I must say that most of our companies really did not struggle hard when it came to PPE because they were ready when the epidemic hit the country. As you all know, the first case in the country was on the 5th of March. We also developed standard operating procedures on management of COVID-19. These were all based on materials from the WHO and also from the National Institute for Communicable Diseases, which is under the Department of Health. Then there was a lockdown and we developed a standard operating procedure on how mine workers were to be managed when they come back from work. And I think these were very useful in guiding the industry when then mine workers actually were allowed during stage 5 to come back, to work. There was a lockdown. Some of the coal companies were essential services, but then there was a special dispensation for mining to work at about 50%, and therefore mine workers did come back. And so this SOP was very useful in assisting companies navigate how to get people back from their homes and what to do when they arrive back at work. We also issued guidance on personal protective equipment, and the key differentiator there for us is that we believe that we were at a higher risk of infection because we do have areas where employees congregate. And so we, for instance, indicated that in our SOP that the minimum that should be utilized is a surgical mask, the medical mask, which is used by health workers because it has a higher efficiency in terms of filtering for the virus than cloth masks, for instance, and other forms of protection. We, by the 18th of May, the DMRE published the guideline on how companies should develop a mandatory code of practice to mitigate and manage COVID-19. And from then on, that was the Bible we used to, manage COVID-19. And it had very specific requirements. In fact, even the disaster regulations that allowed mining to continue during level 5, they required that companies provide quarantine facilities and isolation facilities for their employees. So that was done by the companies. The DMRE guideline, for instance, had a provision where it said people from epicenters needed to be quarantined. That was at a time when the epidemic, had various epicenters in the country, and some of the provinces were at much lower levels of transmission than others. And so employees from those areas of high transmission were then quarantined when they got to provinces of low transmission. Another guidance we put out was on vulnerable populations. And I must say that this issue has been very difficult to manage. As you are aware, all companies, even departments, are supposed to identify vulnerable employees in terms of age and in terms of various conditions like diabetes, hypertension, HIV, TB. And The challenge here being, South Africa has got high levels of HIV. 20% of the adult population is HIV positive. More than people who are more than 40 years old, 20% of them have got hypertension, and we have high levels of obesity in the country, very close to European and countries and the US. And that also goes then with diabetes. And so we had this challenge of how do you rank your employees so that you bring in the ones who are least likely to be affected by, or the outcome is less likely to be lethal, because the contracting of the disease, everyone contracts the disease, but it's if you are a vulnerable person, then you are more likely to have severe disease and to die. That is still with us, the issue of vulnerable employees, because we are now on level 1, and the viral transmission has gone down, and there's the issue of how can we now maybe bring in some of the vulnerable people. We also point out that we did brief the Parliamentary Portfolio Committee on Mineral Resources in June, and also civil society organizations in July. And we had a major initiative. We will provide further material. Aubrey will be able to provide you with further material on this, which is the Eastern Cape initiative. Why the Eastern Cape was specifically identified to require additional support is because in a lot of the provinces that we work in, the Northwest, the Limpopos, the Mpumalanga, Gauteng, a lot of the companies were actually providing support to the departments of health, the departments of education, and other, local entities, and also the communities. And we identified the fact that the Eastern Cape has got provides significant numbers of employees. It's a labor sending area similar to Lesotho and Mozambique. And so it's a labor sending area with large numbers of employees in the industry who are from that province, but there are no significant mines in that province. And therefore, there are no mines that were supporting the Eastern Cape. And because of this, we then, our board approved an amount of, which was from individual country contributions, an amount of 4,700,000. And this was for oxygen therapy and, the oxygen value chain, as we put it. So all of those materials were bought according to what the Eastern Cape had requested, and they were delivered to mainly support the Chris Hani and the OR Tambo districts, which are also which were some of the worst hit, but also some of the most poor of those provinces, districts in the Eastern Cape. So in summary, our interventions on health have been on prevention. We all know the president, every time he is on TV, he tells us what to do. The minister also tells us the same on how we should prevent the transmission of the virus. We, in our sector, we, again, as I said, had to do a lot of assessment of our workplaces regarding which jobs, for instance, or the nature and the manner in which the job is done. What is it about it that can actually lead to transmission of the disease? And an easy example is if, for instance, on your mine, there is a door where everyone needs to open the door using, a handle. At the end, for you to ensure that people are not infected, it's better to take down the door, because then no one is touching that door. People can just move. So it's those risk assessments which were done on every piece of machinery to see, is there a way in which you can reduce transmission of the virus due to touching, the machine. And again, the issue of vulnerable employees. We also did a lot of work on the management, the quarantining. As I said, we were required to quarantine and isolate our employees. And so we had a lot of experience with that. And we actually, the basis of most of our quarantining, we said people should try as far as possible to collaborate with the local health authorities so that we do not duplicate resources. And if, for instance, you have a facility which can serve both employees and the community, then that is the way to go. And that was our general approach, where we said, you know, COVID-19 is a disease of a nature such that you can't have only one sector addressing it, not the public sector alone, not the private sector alone. It is everyone needs to hold hands and do something about the condition so that we collaborate to ensure that we are more effective in our interventions on COVID-19. In the next slide, I will tell you about the additional resources we provided. We have what is an existing program, Khumbule Khaya. It's a health and safety program about reducing fatalities in our industry. Primarily, as you all know, we have, you know, things like rock falls, accidents, and this program is about reducing those fatalities and any other fatalities due to health. So because we had a disease which was causing fatalities, we then actually repurposed some of our funding to research, to disease mapping, and also to behavior training. So we had programs, we still have those programs running on how to improve behavior training so that people can better understand what to do regarding COVID-19. And we also had the geographic mapping of where are the cases, you know, what are the local indicators or variables which can make it possible for the disease to spread easily. It wasn't just mining, it was also the socio-economic factors in that specific district, for instance, the health facilities, whether they were there or not. And also, as I mentioned, research. We still have the research work that we are conducting, which is making us better understand the epidemic. On what I heard being mentioned, which is the statistics, we've got an electronic reporting system which existed before and therefore made it easy for us to convert to having it also report on COVID-19. Initially, we used to produce a daily dashboard. This was at the height of the epidemic, but as you are aware, things have quietened down. So we produce this now on a weekly basis. And the last one we have is for yesterday, where we had screened, that is people who are at the mines. We had about 357,000 people at the mines. And out of those, we've got now a total of 17,832 cases and 190 deaths. And as you can see, there's recovery, you know, there's very few people now who are still active cases. It's about 6%. Most of the people have recovered. We also had a very aggressive testing strategy, particularly with some companies, such that our mining testing rate is about 12% compared to the national one in South Africa of about 7.6%. And most of the cases have been in the platinum sector, followed by the gold sector and also the coal sector. On the next slide, it's just to show you, you know, the provinces. Again, Northwest, that is where most of the platinum mines are. And I also need to say that most of our workers now are in platinum because gold has over the years been going down in terms of the resources underground, you know, the availability of those resources. And so most of our employees are in platinum, and therefore it's not a shock that most of the cases were in Northwest in platinum, and also Limpopo. There's a lot of mines in Limpopo and Mpumalanga, and most of the coal mines are in Mpumalanga. And so those are the key sort of mining regions. The next slide talks a bit to, you know, just explaining the context of the high numbers of COVID-19, we are proud to say that we are the only sector really in South Africa that has kept a record of how many people did catch the epidemic or the virus and how many died. So again, there were a lot of incidents in the beginning, outbreaks, where, then maybe the whole mine, people had to be tested. And at that time, there were a lot of people who were found to have the condition, but were asymptomatic. And so a lot of our high numbers, were generated by the higher testing rates that we had in the industry. The next slide is the last one that I present on, and it's just to explain the issue of testing, which also was an issue in the country as a whole, because everyone, in fact, the normal public sector response to a disease of this nature is you test as much as possible so that you identify people who are even not aware that they've got the disease, so that you isolate them, you find their contacts and you quarantine those contacts. That is the normal public sector response. But we all know that with the worldwide epidemic, then it became that, the situation was that there were no tests available. And the Department of Health had to change the testing strategy, for instance, to say only certain people now had to be tested. We could not do just random, blanket testing. So even in the industry, we had a lot of pressure from employees and others to say, why don't we just have blanket testing? And we had, our approach was that let us follow the NICD guidelines on testing, but where possible, and where companies do have the resources, then they did expand that testing capacity. And it meant that there were companies which actually could test just about all their employees over time and monitor, the conversion rates. But the basic approach was to follow the NICD guidelines on testing. And I think I will stop there, Chairperson. Thank you.
Thank you.
Thank you.
Thank you, Chair.
Mr. Chabana, you can continue with your team.
Thank you very much, Honourable Chair. I believe Aubrey Ramawa will be doing this section here on labour interventions on behalf of Mozambique. Aubrey, please do come in.
Okay, sorry, Honorable, I was just trying to get my mic muted on. My apologies for this.
Okay, continue.
Okay, honorable members, this section deals with the employment trends in the mining industry. As it's obviously expected, the whole issue about COVID has affected the stability insofar as mining is concerned. This is because of the fact that, as it has been earlier indicated by my colleague, Dr. Balfour, that when the pandemic hit, the mining industry could not operate at 100%. Of course, there were other operations that were deemed to be essentials, like essential operations like coal sector that were allowed to operate. You would understand that those were deemed to be essential, for example, because ESCOM had to run, so coal had to be supplied. Some other sectors were operating at 50%, or at some point others were not operating at all. So this in turn does have an impact on the employment of workers in the mining industry. So the demand of commodities was also affected by lack of economic activities in other countries. You would be aware that the exporting of these commodities had also come to a standstill. And of course, the health crisis dealing with the actual sector itself. So between 2012 and 2019, before we even talk about COVID, the sector lost or shared about 65,000 jobs. This is just to show that even before COVID-19 came to be, we had already been experiencing the issue of job losses. And we all know about the socio-economic impact of job losses in the mining industry, particularly when we're talking about a ratio whereby one mining job could be supporting between 7 and 10 dependents. In essence, this is just to indicate that when we talk about job losses, not only in the mining sector, generally speaking, you'd find that it does not only affect those that we employ, it also affects those that are dependent to the employees of the mining industry. So in 2020, January to June, the sector shared about 2,260 jobs. And this obviously coincided with the virus and the subsequent economic lockdown. And of course, there are still Section 189 processes that are still underway that are not reflected on the numbers that are in this particular presentation. So I won't really go into the exact numbers. I think members, because they've got the presentation, they can just refer to the numbers in the column. But this basically what it does is that it just shows the manner in which jobs have been shared, and the hardest hit commodities are diamond, chrome, and industrial minerals, as indicated in the column. So if you look at the mining sector employment trends, from analyzing the retrenchment statistics, it is clear, obviously, that the categories that have been most affected, here we talk about category 4 to 8 employees, they represent 60% of total retrenchments, while officials represents 23% of the category that have been affected by these job losses. So in essence, honorable members, what we're trying to indicate is that by the time COVID hit us, we'd already been experiencing a certain level of job losses. And then basically what COVID did was to basically make the situation somewhat worse. And this is not only because of the fact that we had closed down as a country, but it also because of the fact that we also could not be able to be exporting. And as a result, that in itself did affect a lot of employment. And as it has been indicated earlier, there are still some processes that we're engaged in that could lead to the number sort of like going up. And again, not knowing the total impact and how long this pandemic is going to be with us does in itself give us that impression that job losses is still going to be an issue that we'll be dealing with in the immediate future, based on the fact that we don't know at this present moment the actual impact of COVID and what the picture will be like going forward. Thank you very much. That will be all from my side.
Thank you, Aubrey. If we can then move to Mr. Nixile. And Nix, if you can just show your face briefly, and then you can go off video.
Good afternoon, colleagues. We also had in managing the pandemic, had the responsibility to ensure that there's an orderly return of employees from the SADC countries who work in the South African mines. And this was no mean feat because in terms of the lockdown regulations, no non-South Africans our borders were closed. So we needed to find an innovative way where we had to discuss with the state agencies how to regulate and monitor the return of those employees. In the first instance, we have foreign employees because they occupy quite a very important niche in terms of skills, expertise, and nuances that they render to the South African mining industry. At the height of the mining industry, the foreign workers constituted about a third of the workforce. And now I think we've got a maximum of about 45,000 of these workforce of these employees out of the country. But currently, we've managed to bring back 9,500 employees, and the process of bringing them back entailed having to get the health protocols approved by the Department of Health, the transport arrangements approved by the Department of Transport, the immigration and border control issues to be approved by the Department of Home Affairs. All this thing was done through what is called NAT Joint, where the Department of Mineral Resources and the Department of Health were sort of coordinating issues to ensure that we comply with all the regulatory requirements. And when the workers came through the border, they were tested in their home countries. They were screened for any symptoms of COVID, and they went through the border, have to produce the necessary corporate visas and the relevant documentation to ensure that they are coming to South Africa for work purposes. And then they were transported to their quarantine facilities for 14 days, after which then they were boarded back to employment. Initially, the quarantine facilities were to be located near the mines, but we had to use the other facilities because of the lockdown. Some of the hotels and the resorts were quite open to accommodate our employees for quarantine purposes. And we used TEBA to manage the logistics. By logistics, I mean TEBA has to communicate with the worker in his home country, ensure the transport of the worker from his home to the TEBA offices, and from TEBA offices to the border post, and from the border post to the mining area. So all these things were done. And so far, as I said, we've brought about 9,500 employees, and we only had about 12 cases of people who had COVID-related complications. And in all those cases, we had the protocols in place in terms of contact tracing. And if those who failed the test were in their home countries, we diverted them to the local health facilities, or the mines would take over and make sure that they are well treated and they can come back when they feel better. But there are still some few complications that we have encountered. I think we still have got another 3,500 employees who need to come back. But because of the lockdown level 1 regulations, the 72-hour negative test is becoming a big problem, because the neighboring countries do not have the necessary facilities to be able to assist with the testing facilities. We're looking at empowering TEBA to establish testing facilities in neighboring countries so that the workers are able to produce that 72-hour negative test. And if not, then they will be quarantined at the mines. I think I'll end there, Ibello. Thanks.
Thank you, Nix. Then we're going to move on to discussion of our intervention with communities. If I ask Mr. Alex Kumalo to come in here, please.
Good morning, good afternoon, Chair, Interim Chair, colleagues from the industry, honorable members. I will be very quick. When the pandemic hit early in the year, we were already halfway through planning and implementation of our social and labor plans for the year. Funds were committed. But as we all know, it was almost like a left hook. And we were all caught unawares. Be that as it may, members, We continued as far as we could, working on our social and labor plans, trying to meet those commitments. And it must be made clear that obviously with the lockdown, quite a number of milestones were going to be missed and have been missed. But I mean, that said, the industry dug deeper and utilized largely CSI funds, sometimes funds from foundations and so forth to contribute towards the fight against the pandemic. Some of the interventions that I would like to mention are significant items such as the provision of equipment and consumables for testing facilities. And this includes PCR machines. As you would know, some of those had fairly long lead times, but using the mining value chain in terms of procurement, we were able to get those in and certified and up and running, including laboratories to support them. We also spent quite a bit of our time working with particularly district health offices on the purchasing of PPE and other critical medical equipment, and also working with social development to see to it that we are able to assist in the equipping of hospitals and clinics, and obviously, workers at the forefront. In areas such as the Northern Cape, where there's already a scarcity of water, water tanks became quite important, same as in NCOP, for both public facilities and communities, and the industry played a part in that. As much as water was important, not just for drinking, but also for sanitizing, the issue of food parcels became prominent. Quite a number of families found themselves without breadwinners, so some food parcels were provided to vulnerable communities. On the community front, we also spent quite a bit of effort making sure that awareness is raised through radio, print media, and obviously social media, especially targeting the the youth that way. And in certain areas where we started off early, in places such as the Northern Cape and Mpumalanga, we're able to to work with health offices to provide tracers in certain key municipalities, and we also made sure that in terms of isolation, we didn't only just concentrate on mine workers, but our facilities had adequate capacity to cater for some community members who had tested positive and had been traced through the tracing that we conducted. Then, as we started seeing school children going back to school, we worked with departments of education, and are still doing that, looking at issues of digital connectivity, and we'll continue working on providing or assisting with the provision of e-learning platforms, and this includes members' tablets, access to learning sites, and even training for educators to use the technology that would be there. And one of the things that has not been given adequate attention that we are beginning to look at as the industry is the issue of the provision of psychosocial services. We do not know really the extent of the damage that COVID-19 will wreak on our communities, but it is very clear that there needs to be adequate support in terms of psychosocial services. And at a high level, there were also contributions to the Solidarity Fund and other funds that had been set up, in the regions where our mines are. This slide and the next one just gives you a sense of how we did some of the things. In the Northern Cape in particular, there was quite good collaboration between the mining companies. You have in front of you 4 mining companies, Asman, Kuduman, South 32, and Anglo American, working together with the likes of Katu Solar Park, which is up in Nini Station Mine, and the Community Development Trust, which was originally set up by Kumba. We found that collaborating is very helpful, because it helps us to collectively fight the same enemy without behaving as if it's a beauty contest. And in KZN as well, we don't have a lot of mining entities there, But this is the case of Richards Bay Minerals. Even there, we're quite active in ensuring that we extend the helping hand to our host communities, provision of PPE to clinics, and food parcels to communities. Chairperson, that's where I'm going to leave it from my side. Thank you.
Thanks, Alex. We will now move on to the economics section, where Henk Langenhoven will just take us through some of the numbers. Henk, if you can come in, please. Again, Henk, please just show your face for it so that the select committee can see you, and then you can go off camera after a while. Thank you.
Thank you, Tabelo. My video is on. I hope you can see me. I can't see myself, so I'm going to go off. Honorable members and colleagues, if you remember, only one message of the last 3 or 4 slides is that we're on the road to recovery. The objective of this was to show you the impact on production and on sales. Some of my colleagues have been talking about the fact that we couldn't export. We physically fly out gold, for example, on passenger flights, which stopped. We couldn't get, the harbors were not open, the railway system could not work, we couldn't pass the border. So for chrome and iron ore and manganese, there were physical constraints on the export of our minerals, which is 70% of what we produce is actually exported. So on the slide on the left, you can see a 20-year pattern of our production, and several of the colleagues have been saying that we were not in a good position before the virus struck. So what you see there is a 20-year pattern, and then the insert shows you a more shorter-term vision, and it shows you that we're virtually back at the January level of production. We think, looking at these numbers on the right, you will see we have a number there that says year to August, which is the dark blue bar. It shows for the 8 months of this year how we compare with the 8 months of last year, and we think we will be not worse than 15% lower in production levels this year at the tempo that we are recovering. Can we see the next slide, please? This is just to show you the production levels, and again, I'm using the black bars, are showing you a 12-month comparison. So up to August, 12 months up to August, compared with the same period the previous year, and the year to August, which is the 8 months. And you can see there how the industry is actually struggling to bring production back to the levels that it was. We use January as a fixed point because we were at about 100 on an index basis, and that shows you how the different commodities have been faring and which ones had the highest contraction in terms of production. But there's a silver lining. If we can have the next slide. Commodity prices, colleagues have been saying about lower demand in the world for our commodities, our export minerals. The benefit, in inverted commas, of the uncertainty of how long and how serious the virus pandemic would be, firstly, and secondly, the worry that there won't be minerals available. The combination of the two caused our commodity prices to improve quite substantially. The obvious one is gold, but the platinum group minerals, rhodium, palladium, also shot through the roof. Some of them rose by more than 60%. And the red line that you see on this slide is actually an indication of what happened to commodity prices. So unlike what we would have expected from lower demand, in South Africa's favor, some of the commodities that we export had actually very good improvement in prices. Unfortunately, the blue line is what you see in terms of production, which is a great pity, because if we could produce much more, we would have been able to reap much more benefit from that, which is what I'm trying to show on the next slide, linked to the fact that we export so much. And this shows you sales on the left-hand axis and exports. Now, sales comprises both domestic sales, and I don't know whether you know, but we sell 30 to 40% of what we produce domestically, which is then beneficiated. And the exports, but sales also include exports. Exports is then what we sell outside of the country. And it shows you clearly how severe the exports and sales were affected. In April, we were virtually on the same level than we were in 2016, in January 2016. That's how serious the disruption was. But luckily for us, and this is really the message that I want to leave with you, sales and exports have recovered quite strongly. The numbers that you see there is actually to the end of August. The data just came out actually last week. So very positive response. If we can get production levels up, hopefully the recovery would be strong enough that we won't have that serious a contraction during this year. And just to delve in a little bit deeper on the next slide, I show you by commodity on the left hand how much we are exporting in terms of value. So the blue bars that you see there is by commodity. Just look at gold. Gold's price, the gold price has increased by something like 70% on average in the first 8 months of this year. Production is slightly up. Sorry, production is actually still down, and local sales is also up. But what I try to do is to show the comparison between what the value, because of the commodity in price improvements, are relative to the physical production and physical tonnage of exports that are leaving the country. And then on the right, just to give you a perspective on how we are faring now in August relative to the 12 months that ended January, February, March. So the 12 months, 3 quarters of last year and a quarter of this year give us 12 months. If we look at August, the little blue bars tells you that we are actually approaching the averages that we maintained in the previous pre-lockdown period. And then just to give you a short-term indication of how August was relative to January, and you can clearly see other than copper and chrome and iron ore, the rest of the mining sector is actually recovering quite satisfactory. If it has to continue, because if to cover the gap and to get back to the levels that we were in 2019, we have to improve something like 40% over the last 4 or 5 months of this year to actually end up at the same levels that we were last year. So I thought of just leaving this with you, but the real message is that there's been a strong recovery, and incidentally, the minister tried, our minerals minister tried to make certain that we don't drop lower than 50%. That was exactly the level that we were at in April. So to a degree, great success on that side. And as the DG has been saying, cooperation between us and the ministry and the department, and him fighting for us to say mining is important and we need to get the sector back on track. So with that, thanks, Tabelo, thanks, Chair. I hope this helps and it gives you a little bit of light at the end of the tunnel.
Honourable members, that concludes our presentation, Chair. So we are certainly open to questions and comments from the Select Committee as directed by yourself, Chair. Thank you very much.
Thank you, Mr. Chabane and your team. Now, honourable members, here is the presentation. If there's members that want to ask questions and comment, I'll open for that. I'll ask the secretary of the committee to assist me with the hands. Okay, but I've got the raise the hands now. Yeah, I see Mam Bibi and Honorable Mambatu and Honorable Arnold. Andrew Arnold. Ma'am PB, you can start.
Okay, thank you very much, Chairperson, and thanks for the presentation, which was very detailed, in fact. I just have got two questions, Chairperson. The first one will be, I just want to check with the department whether the mining industry has collaborated with each other and also other stakeholders regarding the provision of the oxygen relief initiative in the Eastern Cape. If yes, can we get a response outlining the extent of the contribution by the Mineral Council, supported by the 13 members companies regarding their contribution in providing the oxygen-related products in the Eastern Cape, which means as part of the combating COVID-19 pandemic. My second question, Chair, will be how many quarantine facilities and isolation beds were made available to be used for the treatment, quarantining, or isolation of COVID-19 patients, especially the mining employees? Thank you very much, Honorable Chairperson. Those are my two questions.
Honorable members, can you hear me? Can you hear me? Okay, Honorable. The next member. Honorable Mabatu Nobua.
Thank you, Chairperson. Chairperson, I've got only two questions that I would like to pass to the Commission, to the Council. Chair, the commissioning of the DEBA institution by the Council to take care of workers from mines, irrespective of the challenges that DEBA itself has been facing over the years. Did it yield positive results? Can we be told as to here are the results in this province, in this country, and here were the intervention, if they can mention that? Because looking at the type of the institution and its background, it raises eyebrows to say, how can you go and pull out a dead man and actually commission a dead man with such a huge responsibility? They spoke about, the council spoke about the intervention with relating to water tanks, food parcels, and other equipments to different provinces and villages. Can we be told which provinces are those? And also, who facilitated the procurement of such water tanks? Were you responsible, or did you partner with any sphere of government? Maybe my follow-up question will come out when this question is answered. Thank you, Chairperson.
Thank you, Honorable Member. The next member, Arnold.
Thank you, Chairperson, and thank you also to the Minerals Council for their presentation. Let me just say that the health and safety of mine workers is a non-negotiable. Then Then in terms of the presentation, Chairperson, there is 3 requests from the committee that we need more information on. The first one is the 189 application, section 189 applications. I think we need to get an updated report in terms of how many, and then in terms of which mines. I think that is the most important one, because that will also now impact in terms of the numbers of job losses in the mining sector, so that we can have that full information. That is the first one. The second one is the provision of the purchasing of PPE. I think we also need to get a list and the expenditure of the PPEs, and also those contracts, everything, the purchasing of those PPEs. I think we also need that information from them. Then the other thing that I want to raise there is the presentation showing us that between 2012 and 2019, the sector has shed 65,000 jobs. Now, if you look now at the period of the current job losses now from January to June, and I know there will come more in terms of the next reporting, in terms of job losses now. It's a 6 months period, 2,260. But if you look now from 2012 till 2019, you can see it's a 7 or 8 months period, year period. We have lost about more than 9,000 jobs annually in the sector. And I think we need to in terms of job savings, saving jobs in the sector, we need to have an intervention in terms of the sector contributing now to the economic recovery plan of the country. Yes, Chairperson, I will leave it there. Yeah, maybe for follow-ups. Thanks.
Thank you, Honorable Arnold. Mr. Shabane, I've got questions also before your team respond. My question, I want you to know whether the Mineral Council has commissioned UNISA to conduct a study to determine the effectiveness of all the control measures currently in place across the mining industry. If yes, will this study achieve the intent objective regarding the improvement which are required in the mining industry? My second question, can we also get the status report regarding progress of the study? Last question, the awareness and health training program which were conducted to educate employees of mining companies with regard to guidelines to manage COVID-19. Were these health training programs conducted in languages which are predominantly understood by employees? If yes, what results did such awareness and training program produce? And was the attendance of such training mandatory for the employee? If no, why not? Thank you. Mr. Shabane, here is our questions. Can you please now allow your team to answer? Thank you.
Thank you, honourable members. Thank you very much for the questions. And yes, I will certainly allocate these questions to the team. So if the team members can please just listen in. Firstly, to the questions by Honourable Bibi about collaboration on the Eastern Cape Initiative. and also the detail relating to the types of products and also how they were procured. Excuse me there. So if you did ask the DMRE, so the DG is welcome to maybe come in beforehand if he wants to on this one. And then secondly, just to talk to, I'm not too sure if we have the numbers of the actual quarantine and isolation beds, but we certainly can give certain examples in that regard. So Tutula, please just get ready for those. And then also, Tutula, please also get ready to deal with the questions from the Honourable Chair Ngwenya on the UNISA study, its effectiveness on the controls. I'm not too sure about this study and just on the progress of the study and how effective it was. Tutula, I'll also just ask you to come in a little bit with the how we were getting our member companies, workers up to speed with understanding COVID. And I'll also talk a little bit on the communication side also about that, just straight after you. And then to the questions from Honorable Mabato about the use of DEBA and its effectiveness. Next, please do get ready to come in straight after Tutula. And then Alex, please, you'll need to deal with the interventions on water, food, parcels, and the like. Please provide the details of the provinces. And also, please, Alex, let's talk about the partnerships that we had with the various departments, the Department of Health and others in the various provinces. Alex, you'll come in after Nix. That's okay. If I can then ask Henk to just talk a little bit about the employment loss, the numbers raised by Honourable Member Arnold's from 2012 to 2020 and current, and also what's currently happening now. If you can just talk to those issues. I don't know if we will be able to answer Honourable Member Arnold in terms of the Section 189 application and the numbers. I'm not too sure if the because I guess the DMRE maybe gets notified here. We won't have those numbers, but Henk, if you do have a sense of what the position was and is, please do come in. And then I think we would have essentially covered. Honourable Member Arnold also asked about the procurement of provision of PPE and the details in that regard. Honourable Member, let me just maybe start with that one, if that's okay. The procurement of a lot of the equipment, PPE, would have actually been done at the mines themselves. So there's no central procurement relating to, well, even mining goods. And as you can imagine, the one was not set up relating to PPE because mines, as you know, are in the business of actually procuring these things themselves. And as Dr. Balfour also mentioned at the beginning of the presentation, we did alert our member companies right in March that you're going to have a shortage of PPE and other equipment. So make sure that you actually shore up your supplies in that regard. So these would have been done by the mines, by their procurement divisions. So literally the hundreds and thousands out there. We do not have the numbers from a central point of view, Honourable Member Arnold, so unfortunately there. I think I've covered most of the questions, okay, and I'll just give our colleagues an opportunity to answer, starting with Dr. Balfour. And if there are any ones that I've mentioned, also my colleagues, please, you can always fill in here. So Tutula, please come in first.
Thank you, Chairperson and Tibelo. I'll start with the collaboration on oxygen with the Eastern Cape. Most of the collaboration and communication was with the department, through the Premier's office and the Department of Health in the Eastern Cape. They determined, what support they needed. We knew that we wanted to assist in the oxygen value chain, and they actually then were able to tell us we actually do have, for instance, oxygen tanks. What we lack is things like oxygen regulators, flow meters, even up to, you know, the oximeters. And those were therefore the things that we then purchased, you know, according to what the department wanted. And we then got back from them, someone did go down from Minerals Council to check on the equipment and how it was being distributed by the province to the various hospitals. The companies themselves that had offered to provide funding, it totaled, as I said, 4,700,000, and it was sort of, they tried to contribute equally to the amount. The quarantine facilities, I unfortunately now no longer have them, you know, off by heart. Earlier at the peak of the epidemic, one did, but companies tried as far as possible to collaborate together so that you don't find that each company has its own facilities. An example is Mpumalanga. Mpumalanga, we did not, especially in the beginning, have a lot of cases. And so you'd find maybe 4 companies and they club together and they hire a 40-bed facility, which is, let's say, it's a motel or it's a ranch. A lot of these facilities, it became, you know, the established hotels because it's easier to meet the requirements of the Department of Health in terms of ablution facilities, you know, for the person and being in their own room. And so those are the types of facilities that were utilized. In Rustenburg, for instance, there was a facility which is a motel, I think the ranch. It had about 180 beds. In Gauteng, Anglo Gold Ashanti had 2 hospitals which had been decommissioned as mine hospitals. And they then provided those to Gauteng Department of Health and also to Northwest Department of Health. And they were used for, you know, these isolation type facilities. And of course, in all of the provinces, it meant the companies needed to have these in place, and they actually did have them. Regarding the next questions around the UNISA study, I didn't go in depth on the research we did. We had 2 types of research. The one type was quantifying and understanding the epidemic, and that work was done by Oram Institute. The other work was done by UNISA. They were looking at, you know, the measures. We're trying to look at not so much the outcomes, but what are the measures we have put in place and have those been effective? And that study was actually completed. It was in 6 phases, and UNISA did fairly good work. We were satisfied with the outcomes. And some of what they found, it was also based on the behavior change model. And some of the results, for instance, showed things like employees were not keen to change, you know, their behavior. The usual, I don't think I will be affected. You know, most people, even with HIV, they don't think they will be affected. And therefore, they don't change their behavior on social distancing or washing of hands or reporting that I am sick. So you have a number of people who would go to work sick and they don't inform the supervisors that they are sick. And what we did was, or UNISA did was, at least for the companies where the research was done, they would ensure that the company was informed of, you know, the outcomes, so that if there were specific gaps that they had found, then they could, the companies could remedy those gaps. So it was a successful, and they also provided us with a tool that the companies could use to assess, you know, going forward, how those there are measures, control measures, whether they are effective or not. On the health and health awareness programs, a lot was done through the Minerals Council, the materials that were produced, and these materials were in the local languages. So if the area had Zulu and Sotho or Tswana, it was usually 3 languages, English and, 2 other languages, which, are the predominant languages in that region. And it was not as easy to conduct education as we usually are able to, or companies are able to, because of social distancing, which therefore meant that companies needed other methods to circulate their health information, SMSs, WhatsApp, and other measures which don't require people to come into a room. Or if you bring people into any common area, it would mean that you need to observe, social distancing. I think most of the training was mandatory. It was part of the onboarding. So for instance, when people went away for the lockdown, when they came back, it then meant part of what they need to go through in their induction is training on COVID, being aware of COVID and how to protect themselves from COVID. I hope, Chair, I've covered all the questions. Thank you.
If I can just elaborate a little bit also on the training and the material. Honourable members, as you can imagine, there would have been quite a scramble for the mining companies to produce appropriate training material and the like. So what we did as a Minerals Council, I mean, so when companies had produced maybe what we felt was very good and industry leading like material, they shared it with other mining companies, just so that they also didn't have to reinvent the wheel. So some of this material, even if you go onto our website right now, we've got a COVID-19 section where you can still just go in there and look at the various material and utilize any of that material for your purposes at the mines. So we did certainly pool not only actually information relating to awareness and training, but other elements relating to COVID. There was also another more technical, I guess you want to call it a portal, that was utilized for the sharing of information that mining companies could actually then also utilize. And incidentally, some of our material was actually also used by a lot of international organizations that learned about the work that we were doing in the mining context. So we actually did have the pleasure of sharing a lot of our material with offshore and other international jurisdictions. If I can then ask next Lusufi to just come in here to talk a little bit about the use of the TEBA and the circumstances there. And next, also feel free to talk about other areas that if you want to elaborate on other areas, please go ahead next.
Thanks, Tibello. Thanks, honorable members. TEBA is actually providing a service to the mining companies as we speak, and therefore our appointment of them was simply based on the activities that were required at that point in time. Just to elaborate further, TEBA used to be almost the version of a labor broker, if I put it that way, for the mining industry, insofar as foreign workers and people from the labor sending areas was concerned. But as at the moment, TEBA is being used as almost like a social and welfare section, a service provider to some of the mining companies after looking after the post-employment care of the workers, their social and social development needs in their areas, as tracing agents where the worker may have some outstanding retirement funds or any other benefit that is due to the worker that the worker may not have taken before he went home. And it even serves the Minerals Council in terms of having a reference database insofar as if a worker has been working in the mining industry in the past. That's one. But two, TEBA has also got a very good infrastructure in the neighboring countries and labor sending areas. In the Eastern Cape, it has offices all over the place, in Lesotho, in Swaziland, in Mozambique, and in Botswana. So it has all that infrastructure that when we considered the work that was required to bring the workers back, there were two components of the work. The first part was for the worker to be traced back in his home country, to be taken care of in his home country, and to be transported in a coordinated manner back to the Republic. And Teba did that work excellently well. So the difference was that instead of the workers, everyone coming on his own, this was a coordinated effort, and Teba made sure that all the documentation that was required, the corporate visa, the passport, the temporary residence permit, motivation as to why they were coming to South Africa. All those documents were prepared by Teba, and they went through seamlessly through our border post to ensure that all the health protocols were complied with. And I think they've done a very excellent job. I think that's what I wanted to say, that Teba did an excellent job. Thanks, Chair.
Thanks, Nils. If we can then move on to Alex. Alex, please, if you can come in and give us just quite a detailed exposition on some of the interventions by the companies, where the partnerships and the likes. Please, Alex.
Thanks, David. Members, it's pretty much on the food aspect. It's all the 7 provinces where mining takes place. So if you look at the Northern Cape, it would largely be the JTG district. So Kuruman, Hotazel, ZF Mgao, which has your Tansabane municipality, where the mining operations are, all the way east west towards Akhenes, and so the Namakwa district, where you find Vedanta and so on. So all of those areas were covered. Needless to say, members, what the mining industry was able to provide could not have been adequate. It would not have solved, the food security issues that came with COVID. In terms of the Limpopo, we've been working very closely with the provincial government, and the task team that was established is led by MSC Mukone, and we meet on a regular basis, somewhere between fortnightly and monthly, to look at all of the interventions that are there. And the issue of food parcels was part of the response from the mining industry. And Limpopo had food banks as well, especially in Sekhukhune. So some of the mining industry contributed to the food banks, others distributed directly to their communities on their doorstep. Likewise, in Gauteng and the Free State, where you would find your Harmony, Gold, and Anglo Ashanti and Goldfields, food parcels were largely distributed directly to communities that are on the shadow of the headgear of those particular mines. You saw on the presentation in KZN, I showed HSB Minerals, but this was pretty much across the entire country. If you go up to Bembe district, Venetia, which is a De Beers mine up north, did exactly the same thing, and so did the mines in the Waterberg region of Limpopo, and same as in the northwest. And then when it comes to water, water was always going to be a challenge, but in the Northern Cape, the industry did one of 2 things: either to provide water tanks using mined water. Some mines in the Northern Cape do have excess water that they have purified, so that was provided. And then in some of the other areas, water tankers were also provided to municipalities to be able to continue providing water to communities. In Limpopo, in as far as water was concerned, some of the mines, such as Anglo American Platinum, started looking for access to borehole water. So they drilled a number of boreholes in some of the communities, but with the lockdown, it became a little bit difficult, to execute. So there was a concerted effort to ensure that the mining industry does contribute towards the issue of supplying water and so on. So the departments that we worked with were largely social development in each one of those provinces. In fact, in the Northern Cape, we still meet on a fortnightly basis with the Department of Health to look at where we are with COVID, to look at some of the supplies that we are trying to get in. So if you look at Kuruman Hospital, for instance, some of the pledges that we had made for ventilators have not been delivered. We're still working on that to ensure that those ventilators get there. But as you might be aware, Kuruman Hospital and same as Posthospital Hospital do not have high care units. So some of the discussions that we are having is post the crisis and into the improvement of the healthcare services in those areas, what do we do going forward? So we are having those ongoing engagements, and we are looking beyond COVID-19, with particularly the Department of Health. With education, and this is both especially in the Northern Cape and in Limpopo, we are also looking at saying, COVID-19 revealed one thing, that we do not have adequate access to digital connectivity for our schools. And some of the schools that do have connectivity, it is unreliable. So we are looking at assisting with broadband. There's a plan that is being hashed by the task team that I said was led by Ms. Mukone in Limpopo, from Lideti in Limpopo. And then in the Northern Cape, we're also working with the Department of Education to do just that, to look at some interventions that we can have in those schools. Naturally, provinces such as the Northern Cape and Limpopo tend to have mining areas. So you'll find that there's a lot more that will be happening in Sekhukhune. You'll find more that there'll be a lot more happening in the JT district down to Zafimtao, but very little, say, in Namakwa, for the simple reason that the mining industry isn't there. But because we are looking at collaborating, we are pulling in the IPPs in the Northern Cape. We've had a number of discussions to see how we can continue working together in terms of ensuring that we do have impact across the entire province, not only where we operate as mines. Just back onto the food issue, we are not oblivious to the fact that a food parcel isn't going to solve a food security crisis. So in as much as we did our best, we are aware of the fact that our best might not have been adequate. And we will be engaging going forward with all of the role players to see that food security is prioritized, because today it's COVID-19, tomorrow it could be drought, or it could be something else. So we do need to ensure that we keep on engaging and find ways of ensuring that there's sustainability in all of the initiatives that we have. A food parcel isn't going to bring us that, but we need to look beyond COVID-19 and get into plans that allow us to ensure that our communities don't have a repeat of this should something happen in the future. Chair, I'm not sure if I have covered all of the questions that you raised, but if not, bear with me and just do ask the questions again, then I'll be happy to to fill in. Thank you.
Alex, if I may, Chair, Alex, please can you just talk a little bit about what happened in Mpumalanga? I mean, I think you've covered Northern Cape very well, Limpopo very well. Let's talk a little bit about Mpumalanga and the collaboration there with the companies, in particular on things like PPE, dealing with the requests from the provinces and the like.
No, thanks, Abel. In Mpumalanga, we were fortunate to have access to the HOD in the Department of Health. And we were able to work with a good doctor on a regular basis to ensure that we do support the department as much as possible. And in fact, Mpumalanga is one of the few provinces where we even had a memorandum of agreement around how we operate. So for instance, in as much as a particular hospital in, say, Delmas or Emalahleni might require PPE or any other medical equipment, the agreement was that the Department of Health would be kept abreast of those contributions, because all donations, we got to understand, have got to be registered with the department at provincial level before they are then distributed to the particular hospital or clinic. So that collaboration with the Department of Health was very useful because of the accessibility of the Department of Health's HOD, and it allowed us to ensure that we did things that were supportive. Often, we like to run and do things in our own way, but I think in Mpumalanga it worked very well that we had access to the HOD and we were able to ensure that all our initiatives support the plans that the department had. So there we did obviously PPE. The likes of Anglo-American coal, refurbished some of the clinics that they had. For instance, the Highfield Hospital, which was then available for use by not just workers from the mines, but also by community members. In terms of, the area around Delmas, where you have a lot of small mines that could not have their own quarantine facilities, working collectively, we're able to explore ways of sharing some of the facilities because, as you know, there's a lot of very, very small operations there that just could not afford, to set up their own either field hospitals or quarantine facilities. So it was through that collaboration and transparency in the way that we worked that we were able to work very well. Needless to say, not all of our members took part in that, but we had a core of 5 members that led most of those initiatives, and that was South 32, Seriti, Exaro, Glencore, and Anglo American Co. Those 5 were the lead minds, and we worked very closely, as I said, with the Department of Health in particular to look at that. And then with the Department of Education, our focus was on the return to school. So the issue of population facilities was dealt with in the schools that don't have adequate toilets, as we know. So we had interventions in that regard. But the pressing need that was identified by the Department of Education was around matric readiness, for example. So as we speak now, our intervention is focused on assisting the department with Saturday schools, so from transporting learners from their homes to the centers on Saturdays, providing meals and getting them back home safely, obviously observing all of the protocols for COVID-19. That is where our interventions around education are. In terms of water, there was very limited involvement by the mining industry. It is as a collective when it came to water, and the municipalities and the districts did not highlight that as a need. But it was mostly on the health aspects, from PPE to equipment to ambulances even, and then on the education front with focus on getting matrics ready for for the forthcoming exams. Thanks, Chair.
Thanks, Alex. Yeah, honorable members, I just wanted, Alex, there, as you saw, just to go into a bit of a deep dive on one particular province. As you can imagine, this is actually not even a full exposition of the kind of work and the kind of interventions from our members, because they would have in turn done a lot of things. And honorable members, remember, this was not utilizing SLP funds, this was utilizing CSI funds. I mean, even establishing the testing facilities that were done for some of the companies like Anglo American, Exaro, Goldfields, and what have you. These were all essentially CSI related funds. And, the mining industry came to the party. I mean, when the testing capacity that we put together, was kind of like almost going to rival what we have in the, the private the private health sector. So, the mining companies really did come to the party in that regard. I just want to maybe just give Henk a chance just to come in on the jobs, if you can, Henk. I'd appreciate that.
Thanks, Tabelo. Thanks, Chair. The one question I can't ask is on the Section 189s. I don't know whether DG Mokoena can give us more information on that. We know that there were several of the smelters that are so slightly downstream from mining that had Section 189 before the COVID-19 hit. So that one I can't answer. The 65,000 that he's talking about, if you split the commodities up, you will see, and I can provide this to you by all means, it's all official data. 60,000 of that was in gold mining. Gold mining production dropped by 70%, 70%. So, that is the explanation for what happened there. And the 5,000 roughly or slightly less than that was in diamonds. The rest, and I can literally mention all of them. I have a slide that shows the overall numbers and then per commodity since 2005, who gained employment and which commodities actually lost employment. It is simply a case of the production and the economic activity that is happening there. If you recall, the first slide that I showed was on the production trends over the last 20 years. And it to a degree, if I can perhaps highlight just a little bit, and I don't know whether that is on the slide, but that is an index. If you draw a line around the 100, which is a base that we used in 2010, we are now below 2000 production in mine. And we've been, since the crash of commodity prices in 2008, 2009, we've been operating below that level that we were at before in 2000. We talk 20 years. So the mining sector, and that's what we meant when we said initially that we were not in a good space when this thing hit us. We unexpectedly got the benefit of commodity prices improving. Everybody thought it was going to go the other way. We often use the World Bank work on commodities as a benchmark, and one of the research projects was a crisis like never before, commodity and supply lines being interrupted, etc. The country was just very fortunate that the commodities that we produce were, for a combination of reasons, reaching better prices. Fortunately, oil, for example, which is not even discussed here, went the other way. There was a surplus of oil, and oil became much cheaper, and that was a huge benefit on the cost side for the country as a whole, but also for mining. So that's the best way I can describe it. There's no real impact of something like mechanization, for example. The industry is in a huge drive to modernize, but modernization must go with the maximum impact backwards into our economy, and it's not a case of actually replacing people with machines. And if I can come back to the gold mining industry, remember some of these mines are at 2.5, 3.5, 4 kilometers down deep, and people should actually not be working there. The faces of the rock in some instances are over 60 degrees. Now, think about you having your kettle nearly at boiling point at 60 degrees Celsius. Machines should do that work. We know there's gold, but it's very, very expensive to keep people safe, and they should actually not be there. But there's a whole, and we can actually give you a lot of information on this whole modernization drive that the sector has. Firstly, to extend the life of mines, but secondly, to do it in a way that will have the best feedback back into the supply side of our economy. Incidentally, we buy 80% of what we need domestically. So the sector buys something like 300 billion rands worth of provisions from the economy. I hope that helps. That's for me the highlights of the explanation. Thank you.
Honourable Chair, thank you for that opportunity. So I hope we covered at least the first round of questions.
Thank you. Thank you, Mr. Shaban and the team, Dr. Balfour, Mr. Nix, and Mr. Kumalo. But Mr. Shaban, I think there's no follow-up question because I don't see hands. But if members wanted to do the follow-up question, can I allow you? I see Andrew.
Yes, thank you.
Honorable Mabatu, you'll be number 2. If there is follow-up question, can you please?
Thank you, Chairperson. No, there is a reason why I have mentioned this, and I think the department is here and need to follow up in terms of the mining companies here, because we can't just allow that mining companies make use of the resources of the country and not be also responsible in terms of the operations. Now, there was complaints, and I think the department must follow this up with the inspectors and also give us a report in terms of complaints from workers, especially mine workers, in terms of the quality of those PPEs
and then also in terms of where those PPEs was requested from. I think that is the reason why I've asked that question, but it's fine. Yeah, thanks.
Thank you, Honorable Member. Honorable Mabatu.
Chairperson, I wish we could have gotten this brief before, relating to all the activities that the council was involved in during COVID. Like, they are giving us the brief relating to the Department of Education's intervention. And I'm quite excited because I hear that you are going to be assisting healthcare workers, hospitals. I'm not only excited because I'm from a small town, Kuruman, that you are going to finally assist that particular hospital, which was about to turn into something else. But throughout the country, I can see that your interventions are indeed going to assist the poor health workers who are putting more effort into saving ordinary South Africans' lives. Chairperson, fraud and corruptions have clouded the COVID-19 fund. And what disturbs me was that a lot of money was poured into my province. We were not sure where this money was coming from. We were not sure why politicians were parading. I'm speaking about the Northern Cape and John Taolo Gaetsewe in particular, where I come from, where fraud is clouding the issue of the food parcels, where Somalian shops were sold food parcels, particularly donated food parcels, in exchange of cash in the JTG region. Now, I don't want to say it's a lesson to companies that are actually pouring in money to assist our poor communities. What I want to ask, whose directive was it that you even involved municipalities, knowing very well that when you involve municipalities, politicians are going to take over? We've got social development, which is in charge of our social issues of our communities. Why didn't you involve social development instead of involving municipalities like John Taolo Gaetsewe, Gasigonyana, and Tsantsabane, where the mayor was in fact found with food parcels in her own home? That is my question. Thank you, Chair.
Thank you, Honorable Member. That was the 2 follow-up questions. Honorable Shabane. And Mr. Shabane, I mean to say.
Honorable Chair, I'll take the title. Thank you very much. I'll gladly. Honorable Chair, certainly from the comment from Honorable Arnold, I guess that one will be for the DMRA. And then also thank you to Honorable Member Mabatu, just in terms of commending the work that mining companies did. Honorable Mabatu, sure, you're right. I mean, fraud was really such a big problem for us, and trying to ensure that what we were doing actually reached the beneficiaries. You can understand that, I mean, even with things like food parcels, honorable members, there were times where the mining companies prefer to actually be distributing the food to the communities themselves. But there were times where they were actually prohibited from doing so by certain municipalities, saying, no, you had to go through a certain procedure. And I'll ask my colleague Alex to just come in and elaborate here. So in a lot of instances, and I think also where we were able to collaborate, we did certainly collaborate with different arms of government. I mean, especially the Department of Health. We did absolutely collaborate with them quite a lot. And even ourselves, I think Dr. Balfour spoke about how with our initiative in the Northern Cape, well, firstly, we were not going to go to a province and decide what needs to be done. Dr. Balfour sits on the Premier's Advisory Committee, so she was very close to what was happening there. And also we were talking directly with the head of hospitals and their procurement managers and their technical people in terms of trying to understand, well, what should our intervention be targeted at? As in, what is absolutely needed? What are the quantities that are needed? And even with them, we said, well, due to some of the concerns that some of our members would have, we insisted also ourselves as the Minerals Council, actually, in some instances, sorting out the procurement of those items directly, then going into their central procurement system. And as Dr. Balfour even said, we even had one of our colleagues flying down to the Eastern Cape to do a physical inspection, to see, to eyeball the goods that were delivered in that regard. And you can understand in a situation where, I mean, this was an emergency. These things were needed absolutely on an urgent basis. And so it really was a challenge trying to ensure there was proper governance in a lot of these instances where the mining companies were making the interventions. As to the working with the municipalities, it is very, I guess, as mining companies, one is also often caught on between what you can do as an individual company and what you must be as being told by the rightful representative of those communities, which is the municipalities. In many instances, yes, we absolutely had to work with local and provincial, well, district municipalities, but we certainly, in this instance, due to this being a health pandemic, were hugely guided by the Department of Health. I mean, we had engagements and discussions with the Department of Health at a very national level, Dr. Kitsnasamy, even in terms of our testing capacity with the NHLS. So it wasn't just us doing our own things. It was always, in all instances, trying to ensure that we were engaging with the correct authorities. I will just ask if my colleague Alex can just come in on this one, and then also Tutula, if you're also able to come in here, please. Alex, if you want to come in first.
Thanks, Debelo. Thanks, Mabatu, for your question. It was a difficult one to deal with. We work very well with all of the municipalities in Jomrulong, Khasakonyana, Hamahara, and obviously in the JTG district, Mr. Mulaule, the district MM. And when the call for food parcels came, it came from the Department of Social Development. And the deliveries, so the mines procured food parcels and delivered them through DSD in the Northern Cape. So the JTG office. We did not go beyond that in terms of going directly to municipalities. I do recall Mlaule providing us a list from the district itself in terms of some of the interventions that were required, but we insisted on working through the regional, the district offices of the of social development and of health. In as much as we try to ensure that we provided food parcels rather than cash, some of it was beyond our control, but I do take it, and it's a lesson to be learned, that we needed to be a lot closer to the process despite the fact that our people actually were not on site because of the lockdown when we started with the food distribution. But it's a good lesson to learn, and we'll bear that in mind. And thank you very much for raising it. But in terms of working through the district in particular, as I said, we engage with Mr. Mlawule on a regular basis, and he's been insisting that with the district-driven model, the district is becoming the core. A lot of the planning, that's the district one plan, is going to happen through that, and he has already insisted that we start working through that. And look, we are to a certain extent to blame, because even when we managed to get the MM of the district to meet with our CEOs in the province, we requested that the local MMs be invited, but they were not on the meeting, on the call for that meeting. So lessons learned, we will improve how we interact. And I take it on the chin that maybe we could have done better to ensure that food parcels did indeed get to the people that they were meant for. Look, maybe we also need to ensure that we are closer to databases such as the indigent list, because the municipalities and DSD have those lists, and we don't as an industry. So again, then we work through DSD, and we are really not sure of the mechanics of food distribution once those deliveries were made, to the DSD offices. But thanks for raising it. We will take into account and we'll manage it better should we need to in the future. Thank you.
Chairperson?
Yes,
can I just make one comment?
Okay.
From our side to the council, it is not an attack to you, the council, but rather an advice from the side of us in the EFFs represented in the select committee that whenever resources or monies are poured into a province and a certain political office receives that, distribute that to other spheres of government, either provincial or local. All those resources are gathered and they are politicized. This is what we saw through COVID-19. All your efforts that you made for ordinary South Africans to benefit from your sweats went to politically connected people. Ordinary South Africans didn't receive those things, especially in my province, the Northern Cape, which is regarded as a high morality province. I can tell you, I have identified and I have spoken on this platform today what transpired. It should be a lesson, yes, I agree with you, as to how you do things moving forward. If there's a coordinating committee in a province, like you are saying, Dr. Balfour was part of it, she should have made sure that everybody is represented, not only one party, because it is where you got it wrong. And it is where corruption clouded everything in the Northern Cape. Thank you, Chairperson.
Thank you, Honorable Member. Honorable Shabane, I hope your team has done. Are you done? Okay. Honored members, I think we are done with the presentation and the questions and follow-up questions. Hopefully, honorable members, you are happy with the answers. If you are not happy, you must write down for the department. Honorable members, I don't know whether other members that are still here. I would like to release the council so that we can discuss whether we continue with the minutes or not. Thanks very much, Mr. Shaban, with your team.
Honorable Chair, apologies, I went offline for a second there, so I didn't catch what you said. I don't know if there were any further questions. But it's
no, I was saying, are you done? Do you have anything that you wanted to say to the members?
Honorable members, I think we are done. Thank you very much.
Okay, thanks very much, Mr. Shabane. Thanks very much for your presentation. It was very, very important to us. Hopefully, if there's anything maybe the members want to raise, then they can write to the council. I'll ask you to be released so that I can be left with the members and discuss other matters. Thanks very much.
Thank you very much, Honorable.
Okay, honorable members, can you please left just for discussion the minutes? How are we going to take it? The secretary of the committee, I'll ask you to assist us in terms of the minutes. Are we forming the quorum or?
Thank you, Chair. We form a quorum. The minutes of the 13th of October is before the committee.
Okay. All right. Honorable members, here are the minutes in front of us. Chair, are you back? Chairperson?
Yes, ma'am. I was in the meeting. I was in the meeting all along.
All right. Chair, can I give it to you, the minutes, please, so that you can close the meeting for us?
If my network is fine.
No, I'll observe that.
Okay, let me check. Okay. Good afternoon, members. Let me check with you. Did you receive the minutes on time? Members, did you receive minutes on time and read them?
Yes, Chairperson. Yes, we did, Chairperson.
Okay.
We received
any correction? Today you didn't write the economic from, I think, economy. Honorable.
There's only one day, economic freedom fighter, but it's fine. I must just correct that one. Yeah, it was in the previous.
So, okay. Any move for the adoption of the minutes?
Lindway PP move for the adoption of the minutes, Chairperson.
Thank you very much, Mama. Any seconder?
Honorable Ngwenya move the seconded the minutes.
Thank you very much, Honorable Winnie Ngwenya. Anything, Aska?
That's it, Chair.
Is it only one set of the minutes?
That's correct, Chair. So far, the committee is up to date with everything that it has to adopt. So the minutes was the only thing outstanding.
Okay. Now let me take this opportunity, members, to thank you for taking your time to attend this meeting. I know from morning you were very, very busy, but you make time to attend it. Thank you very much. Even for your participation in the meeting, you participate very, very well. You ask a question as you're supposed to check whether the department and the entity SOE, they're doing the right thing. Thank you very much for doing that. I am sorry, so sorry for today. My network was not okay. That's why even now I'm not using video. I mean, I'm not using video, but you are released for this meeting. This meeting is officially adjourned till we meet in the next meeting.
Thanks,
next week, Tuesday. Thank you very much, Mama. Thank you very much.